Welcome back. There might come a time in a woman's life,
or a man's life,
when they consider going for a nip here or a tuck there. And for most people, it's in their early 40s when the early signs of ageing start to appear.
But what cosmetic work should you consider getting done, and will it make you look any younger? Cosmetic surgeon Dr. Will Mooney joins us for more.
Morning.
Dr. Will.
I've only got a year to go. What happens to our faces in the 40s? What's going wrong?
It's all going to fall apart in the next 12 months. No, look, things change as time goes by. In particular, there seems to be a watershed time change around late 30s, early 40s. In particular, losing volume in your mid-face. And it really makes you look a little bit more drawn.
So when you say the mid-face, which part of the face are we talking about?
So your cheeks become a little bit more gaunt.
Right.
And you lose volume around your mouth. And so the line, say the line from the corner of your nose to the corner of your mouth becomes more obvious, your lips lose a little bit of volume, and they're the things that make you look older in your early 40s. So
what are the best procedures for those parts of the face? And the parts of the face you're talking about are in here, are they?
This Channel 9's given me this
pointer.
Dr. Evil pointer.
No, budget. Big budget here.
Look, you really get changes around the mouth, and Rachel looks fantastic.
That's Rachel Weisz, yeah?
Yeah, I think she's probably had a little bit of help. These lines around the mouth become deeper, and it looks like she may have had some help there. Your lips lose volume, her lips have got great volume still, and you lose this sharp line along your jawline here, and that seems to get a bit of jowling, and so they're the things where people change. And often women come to me thinking they're ageing around their eyes, but it's often around their mouth that the problems exist.
Right, okay.
Right. So we've had that Rachel Weisz. Let's have a look at some other 40-plus celebs and see how they're looking. Now, Christina Applegate. She's been through a lot over the past few years because she did have breast cancer as well. So do you think she's had some work? Can we get her up on the screen?
Look, if we could find her, it'd be great. I think,
she's gorgeous.
I think she looks amazing. She's already got high cheekbones by virtue of her bone structure, and that's genetic. And that's something you can buy and you can't luck at the draw. And those lovely high cheekbones keep her looking young. Look, if she's had, I don't know what treatment she had for breast cancer, but certainly you can see a change of increased volume in her lips, and that's something that the vagaries of chemotherapy might have dragged from her face. So it looks like she's maintained herself pretty well. She looks natural, and that's the most important thing.
Right, let's have a look at Winona Ryder, who...
She stole this face, by the way.
Oh, she looks like she stole some pretty good moisturiser as well. I think that it's hard to tell with celebrities because this might have been a bad day, that might have been a good day. Look, this looks like it's an award ceremony, so she's got the best hair,
this looks like one of those things in the papers where you sort of have to, you can circle the things that are missing. She's missing a whole bunch of moles now. Can you see that?
She is too. See, all these freckles that she used to have down.
She's all freckly.
She lost her bling as well, so I think that some things have come and gone. She's got some good volume maintenance in her cheeks. She's smiling with no crow's feet for a woman of her age. That looks a little unnatural, but I think she looks good overall, and she certainly has a youthful glow with the skin, so I think she looks good.
Let's have a look at some of the boys now, like David Arquette. You know, he's had years of a bit of party, but he looks pretty good to me. I'm going to say I'd kiss that.
I don't know. It looks like I think he needs his friend back. And I think since he lost Courtney Cox, I think things have he's hit the wild times again a little bit. I think you look at people's eyes to see if they're healthy or not. He's looked a little bit too much
upper forehead movement there.
There's a lot of
He's really trying to prove no Botox here.
Exactly.
Look, I think there's a bit of a split, and I've noticed a change in between guys and girls and what they want with cosmetic treatments.
What do guys generally want? Because some blokes are watching, like, I could do with a bit of something.
I think that,
I could do with a lot.
I think courtesy of people like George Clooney, that the mantle of ageing sits more comfortably upon guys than girls. I think guys don't mind having a bit of character in their face, a bit of grey hair, a few wrinkles. I think it looks becoming on guys. I've seen a change away from using a lot of paralysing agents with men.
Right. Now, we do have to have a look at these new pictures of Lara Flynn Boyle.
This is scary.
She has actually gone a little bit too far with the trout. I mean, she's always been fond of a lip injectable, hasn't she?
Yeah, well, she really is the Easter bunny boiler, isn't she? I mean, we've got her weight has just gone up and down radically as years have gone by.
So what's going on here, Dr. Will? Because it's almost like a geisha kind of
look. Not overly fond of that geisha look all the time. It really looks like she's had a lot of filler in her lips. And I don't know if you go back to the previous picture, but her legs are stick thin, her face has got a lot of volume, and that's incongruous because it doesn't look real, it doesn't look unreal, it looks not real.
It just looks weird.
It just looks weird, and it looks incongruous. The walking cast, the whole thing is just
not even real, that cast.
Cast isn't real.
What areas of the face are most telling of our age?
Most telling. I think the clarity in your eyes tells whether or not you're hydrating, whether you're looking after yourself, whether you're eating right, whether you're getting enough sleep. But specifically for fillers, as I said, around the mouth, the jawline really
Let's just talk about this, Dr. Will, the treatment options. So
I think you've got to be, number one, be subtle with whatever you do. Don't try and look fake or unreal. The treatment around the eyes, really paralysing agents around the eyes, such as Botox, just soften crow's feet, not eradicate them, but soften them. Frown lines in particular. And just brow shaping seems to be the new vogue, and it's really using micro areas. Filler is the treatment of choice around the mouth and the lips, and also you can look at some thread lifts or some micro lift options as well.
Well, can I ask, if you don't have a lot of money, say you've got a struggling family, you do want to do something to touch yourself up, what's the cheaper of the options of these?
Look, the cheapest of the options is they're all free. Stop smoking, stay out of the sun, hydrate, get enough sleep.
You'd be out of a job, mate. This is one.
But it's honest and it's true. The next thing you can do is chuck out your cheapy moisturiser and invest in something that's a little bit better. Botox is probably the cheapest option after that.
All right, thank you so much,
Dr.
William
Will.
Mooney.
Happy Easter.
Happy